Before you turn to the other side one more time trying to find a position that doesn't hurt, you need to hear this. Most people with hip pain spend the night tossing and turning in bed. They try one position. It doesn't work. Try another. It gets worse. And they wake up more tired than when they lay down. But what almost no one knows is that there's a specific reason why some positions relieve pain while others make it worse. And understanding this can completely change the quality of your sleep starting tonight. There's just one problem. If you only fix your sleeping position and ignore what's actually causing the pain, you'll keep waking up in the middle of the night. Because position helps, but it doesn't fix what's failing inside the hip. So stay until the end, because I'm going to show you the best way to sleep and also what's really happening while you're trying to rest. You lie down in bed. Turn onto your side. Your hip presses into the mattress and starts throbbing. You change positions. Lie on your back. You feel okay for a few minutes, but soon it starts bothering you again. You try sleeping on your stomach. Then your hip twists and hurts even more. You spend the entire night changing positions. You don't rest. You wake up stiff. And during the day, the pain gets worse because your body never recovered. Worse still, you start to fear going to bed. The bed, which should be a place of rest, becomes a source of suffering. And with every poorly slept night, you feel more irritable, more exhausted, more discouraged. It's not just fatigue. It's the feeling that nothing is going to get better. Now, about how to sleep with hip pain, I'll get straight to the point. The best position for people with hip pain or hip osteoarthritis is on your side, but with one important detail. You need to place a pillow between your knees. Why? Because when you lie on your side without support, the top hip pulls on the bottom one. That stresses the joint and increases internal pressure. The pillow aligns the pelvis, distributes weight, and relieves compression. If you prefer sleeping on your back, that's fine. Just place a pillow under your knees. This relaxes the lower back and reduces tension on the hip. Avoid sleeping on your stomach. This position twists the hip, strains the spine, and almost always makes the pain worse. Now, the mattress also matters. If it's too soft, you sink in and the hip becomes misaligned. If it's too hard, it increases pressure. The ideal mattress is firm, but with a comfort layer on top. So to summarize, on your side with a pillow between your knees or on your back with a pillow under your knees. No sleeping on your stomach. That alone should bring you relief tonight. But here's the problem. Even sleeping in the right position, the pain can come back. Because position reduces pressure, but it doesn't fix what's happening inside the joint. And what's happening is this. While you sleep, the hip joint is trying to recover. But if it doesn't have the support it needs, it stays inflamed, stiff, and dysfunctional. You wake up stiff not because you slept wrong. You wake up stiff because your hip spent the night trying to function without the right fuel. And this brings us back to what most people ignore. Some believe hip pain is just wear and tear, that it's age, that it's normal, that there's nothing to do but endure it. But if it were just wear and tear, why are there people in their 70s or 80s who sleep peacefully and wake up without pain, while people in their 50s who never did heavy sports wake up groaning? The answer lies in a protective layer inside the joint, a kind of natural gel that lubricates, nourishes, and cushions the hip. This gel is what keeps everything moving smoothly. When you're young, it's dense, thick, like jelly. It does 3 essential things. It lubricates the bones so they glide without grinding. It feeds the cartilage, which has no direct blood supply. And it protects against inflammation, acting like a barrier. But after age 30, you begin to lose a substance called hyaluronan. It's what holds water inside this gel. And when it decreases, the gel thins out. It dries. It loses its function. If you're 60, you may have already lost around 30%. If you're 70, you could have lost half. And when the gel thins, 3 things happen. Bone starts rubbing on bone, cartilage starves, and inflammation takes over. That's why you wake up in pain. It's not the position, it's the lack of internal protection. So yes, sleeping in the right position helps. But if the gel keeps thinning, the pain comes back and gets worse. You've probably tried orthopedic pillows, changed your mattress, taken anti-inflammatories before bed, done stretches, and nothing truly solves it. Do you know why? Because those things reduce pressure or inflammation, but they don't replace the gel. They don't thicken the fluid. They don't restore the protection that was lost. That's why you feel a little better, but the pain always returns. There was a fascinating study conducted by researchers in a Japanese village called Yuzurihara. There, elderly people work in the fields, squat all day, sleep on hard futons on the floor, and don't feel hip pain. Scientists wanted to understand what protected them. It wasn't genetics. It wasn't luck. It was a purple vegetable they ate every day. This vegetable stimulates the body to produce more of that protective substance that holds water in the gel. They didn't know this, but their bodies kept the gel thick and healthy. And that's why, even sleeping on hard surfaces, they woke up feeling fine. This proves the protective factor exists, and that it's possible to restore it. Today, there's a natural approach that works exactly on this. It acts on 3 fronts. First, it helps replenish the substance that thickens the gel, restoring density and cushioning ability. Second, it fights the inflammation that attacks the hip during the night. Third, it provides ongoing support so the body can keep this gel healthy. In clinical studies, people who used this approach for 6 months experienced progressive improvement. In the first month, they already felt a difference. By the 6th month, the improvement was even greater. Comfort, mobility, flexibility, everything improved. But there's one important detail. It doesn't work if you stop halfway, because the body needs time to rebuild what it lost over years. Consistency beats urgency. Look, none of this will fix things overnight, but doing nothing won't stop it from getting worse either. The truth is, your hip needs support, and the longer you wait, the thinner the gel becomes, the more the pain increases, and the harder it is to return to normal. You deserve to sleep well, to wake up without pain, to get out of bed feeling energized. And that's possible when you understand what's really missing. Below this video, there's a link that explains everything about this approach, how it works, what it replenishes, and how you can start today. There you'll also discover how a natural substance can thicken the hip's protective gel by up to 10 times. Your hip wasn't made to lock up. It was made to move. And with the right support, it can work again. Click the link in the video description and see for yourself.